My partner and I are on the affirmative side for universal health care, and I want to focus on four main claims for universal health care. And the first one being that the United States and its citizens are not, or do not experience the best health care in the world by any means necessary. And in research done by Dr. John R. Batista and Dr. Justin McGavey, in cooperation with the state of Connecticut and proponents for universal health care, studies on a variety of diseases such as coronary artery disease and renal failure show that the U.S. rank below Canada and a wide variety of other industrialized nations. Now what this means is that the U.S. is the only industrialized country that does not use universal health care. The U.S. actually uses privatized health care, which means that we go through big corporations like if any of you heard Kaiser, Blue Cross, Blue Shield. They're the ones that are in charge of our health care, not as opposed to universal health care, which is, there's two kinds: single payer and multi-payer. Single payer is when the government is in charge. Multi-payer is when it's split 50-50 between the people and the government. Some more information by, again, Dr. John R. Batista and Dr. Justin McGavey shows that the U.S. ranks between 50th and 100th in immunizations, depending on the immunization, and overall in the U.S. 67th right now, behind Botswana. So when I say 50th and 100th in immunizations, I mean the effectiveness of our immunizations. Again, another study done by the two doctors shows that the U.S. ranks 21st in life expectancy for men, down from 1st in 1945 and 17th in 1960. So that means we're progressively, in relative gains, getting worse. In 1945, we were ranked 1st in life expectancy, and in 1960, 17th, but up to this day, 21st. The U.S. ranks 20th in life expectancy for women, down from, again, 1st in 1945 and 13th in 1960. Those are big jumps. The U.S. ranks 23rd in infant mortality, down from 12th in 1960 and 21st in 1990. So progressively, the life expectancy for men is growing shorter, women the same thing, and more children are dying in relative, when put in perspective with how we were doing in 1945 and 1960. The second argument I'd like to focus on is that there are many misconceptions about universal health care. Many people believe that private health care is productive because if you pay for your health care, you will not abuse it. So a lot of people out there, if you ask them about private health care, they say, it's good that we pay for it. It's good that it costs a lot of money because we won't abuse it, we won't run out of medicine, stuff like that. But what happens to the 47 million American citizens that don't have health care? There's no safety net. They're not trying to abuse the system, they're just trying to use it. And I'm sure everyone in here knows somebody, friend, family member, I know I have some, that aren't covered by universal, or aren't covered by health care, because sometimes it's even something just as small as paperwork. And this is a study done by Anwar Harris, and when asking multiple people about health care. And this is the answer she got is what I was just saying, is the logic people believe that if you do have universal health care, one of the biggest problems is that you're going to run out of whatever you have. It's going to put too much strain on the system. And I just want to say that this is false because the U.S., while we may not be first in health care, spends more in its GDP, which is gross domestic product. We spend more money into our health care system than any other nation. We use 16% of our GDP over anyone else. So you're paying more in taxes for a system that doesn't work. Another study she found when doing her research is that the fear is the universal health care is implemented. People will visit the hospital for any reason because they do not have to pay. And again, I wanted to reiterate that that was false. Then there's a big misconception. This came around during the Cold War, and still a couple of people still believe it today, and that is that universal health care is a socialist medicine, and by doing this, it will become a communist country. A lot of people believe this because Canada did it. I mean, this couldn't be farther from the truth. As I said earlier, that every industrialized country has it. The UK, for example, is not a socialist country. They have it. And they're actually ranked 18th and spend 6% of their GDP, so they're spending almost half of what we are spending on healthcare, and they're still ranked almost 18 spots higher than us when compared to the effectiveness of their healthcare. The third fact I'd like to talk about is universal health care can solve the depleting healthcare situation in the United States. Single-payer universal health care administered by a state public health system would be much more democratic and much less intrusive than our current system. Consumers and providers would have a voice in determining benefits, rates, and taxes. Again, this is by the two doctors who worked with the Connecticut proponents for universal health care. The U.S. Currently denies access to health care based on the ability to pay. Under a universal health care system, all would access care. There would be no lines, as in other industrialized countries, due to the oversupply in our providers and infrastructure. And this is a direct quote from those two doctors, and what basically saying is what I said earlier, is that we're spending more money on anyone else than healthcare. So to go to universal healthcare and to cover everyone, including those 47 million Americans currently uncovered, we would not run out of supplies because we are spending more in our infrastructure and from our providers. Another statistic, this one's from Tim Foley, a scientist who worked on a lot of these surveys for healthcare. Noticed that 95% of Switzerland had some form of healthcare insurance under their universal healthcare, compared to the 85% and declining in the U.S. today. This one's taken from the WHO, which is the World Health Organization, and they took a massive survey, actually the first one ever, I believe it was 3 years ago. So the World Health Organization said, insurance protects people against the catastrophic effects of poor health. What we are seeing is that in many countries, the poor pay a higher percentage of their income in healthcare than the rich. And that's because, again, it's all about relative gains. The rich pay a smaller amount for the healthcare, but the poor people obviously can't afford it. And those who can, sometimes a good portion, if not almost all of their check will go to healthcare for a single year. Again, this one's taken from another statistic from the WHO, said that as it carried out its first ever analysis of the world's health systems, using 5 performance indicators to measure health systems in 191 member states, it finds that France provides the best overall health care. France is just another example of universal health care. France is ranked first, and they do have a universal health care system. Okay. And then my last claim would be universal health care is a very foreseeable and achievable outcome for the United States. And this is a quote taken from the Americans for Democratic Action. A single-payer healthcare system neutralizes and ultimately eliminates the power of healthcare industry lobbies to inflict costs and provide portability for benefits not tied to a job. And what they're saying there is that by going to universal healthcare, you eliminate the useless need for big companies like Kaiser, these people have no concern for what goes on in your life. And it's been shown throughout history that all they care about is how much revenue and money they can bring in.
Okay, you're a minute over, so I got to cut you off here.
Okay.